call the subcommittee meeting to order. In attendance, so if you'll just introduce yourself, and I'll start over with Jeff because Jeff is in a dual role. He's a member of the subcommittee and task force, but he's also a member of the PEIA Finance Board. So we'll start with Jeff and go down the period.
Jeff Christian.
I'm Perry Bryant.
Craig Blair.
Dale Lee.
Joe Letton.
I think Doug Nelson is going to be on the phone a little bit later for that. So, the subcommittee was formed at the last full task force meeting after a proposal was made to revise the 80-20 rule by saying the state shall put in no less than 80% and employees shall pay no more than 20%. Because it has some statutory requirements with that, Senator Blair suggested that we look at and Perry Bryant suggested that we look at a subcommittee to look at the statutory requirements and everything, and then really come up with long-term solutions or recommendations rather than just a simple thing as no less than, no more than. That's how this subcommittee came into effect, and with that, we'll open.
Actually, Mr. Chairman, can somebody describe what the current problem is now with the 80-20? I mean, I've heard in discussions things you can do with it, you can't do with it. There's probably some restrictions, but I'm not sure I, for one, know what they all are. Maybe Perry's going to explain that when he goes over his proposal, but I was just, not in the weeds, but just kind of a 30,000-foot level about how it gets done and what it can affect and what it can't affect.
And just very quickly is, whenever the legislature increases the appropriation to PEIA,
right.
It mandates that there be a corresponding 20% increase in the employees' premiums. So it's a straitjacket. It doesn't look at other cost sharing in it, nor does it look at difficult years when the legislature may want to appropriate. I mean, we see what's happening right now with the governor trying to get $100 million into PEIA, figuring out a way to get that in there without triggering $20 million with the automatic increases in employees' premiums.
Okay. Before we go any further with this, we've got sort of our perspective of that. I wouldn't mind having the PI board, or at least their attorney back there, to give their description of what they see and how the 80-20 rule applies to the work that they do.
Now, I'm just trying to make sure we all understand what the I don't want to call it a problem, but what the issue is and what the challenge is in dealing with it.
So Ted, you, the attorney, want to speak?
Sure. So under the 80-20 rule, there is an exception for it before we get there. But under the 80-20 rule, the intent was, I believe, by the legislature, that to have the employer contribute 80% of the premium for health insurance for people, and the employee to have a share of 20%, and put that in a balance. At the time, it was like 85%, and over like 5 years, the legislature stepped it down to 80-20 and decided that was the fair ratio of premium conversion for people. PEIA has taken that to mean globally 80-20 in the aggregate. So, like you said, if you're making $20,000 a year, you're not paying 20% of your insurance. If you're making $125,000 a year, you're not paying 20% of your insurance. In aggregate, it comes out to 80-20, and the actuaries develop that plan every year. The plans are not 80-20. Plan A is not 80-20, Plan B is not 80-20. In aggregate, though, we're all 80-20. So in essence, the legislature gives us $800 million, $200 million comes from the employees. And we can't change that ratio. If you don't give us any more money, the legislature, all that's available for us to do if we need more money is to cut benefits. Our hands are tied. The legislature, in theory, sets our premium level by the budget we're allocated.
So with that in mind, because in the past few few years when there hasn't been additional money put into PEI. If you look at total out-of-pocket costs and you add in your deductibles and co-pays and out-of-pocket costs and everything else, the employee's share is more than 20%. The employee is paying, I think, about 23, 24%.
We need to look at this in two ways, okay?
Yeah.
So when we talk 80-20 of the legislative analysis, we're talking premium cost share.
Right.
What you're discussing is the actuarial value of the plan. What's the actuarial value that the employee has to accept? You know, again, premiums buying the ticket to the theater, that's the 80-20. The stuff you use, the deductibles, the co-pays, that's buying the popcorn and the soda at the theater, right? So what you're talking about is what the member's gonna do with popcorn and soda when he gets inside. That's the actuarial value. Today, Dave told me 82%?
We're at 82% before these changes, so we're probably at 84% today.
What that means is that the state, once you get in the door with your premium, the state is paying 84% of the cost of care. And the member's share with deductibles, co-pays, out-of-pockets, on average, is 16%, right?
How does that change to an employee that's making, say, $20,000 a year or $30,000 a year versus somebody that's making $120,000?
So the interesting thing about the way PEI is structured, when he talks about average actuarial value, and by the way, the actuarial value does change slightly by salary tier, which is what you're asking. On the whole, though, it's close to 84%, as he said. Remember, our deductibles and our out-of-pockets are all tiered to salary. So if you're on $20,000 a year, you've got a much lower deductible, much lower out-of-pocket. And if you're at the high end, it's just the opposite. And although that varies a little bit, I'd say it's still close to 84% across all the tiers, but I think the higher the tier goes, the lower the actuarial value. And it's lower than 84 at the higher
Plan
tier
A.
again. Yeah.
Plan
Yeah.
Thank you.
Mhm.
Any other questions before we look at our first proposal? Okay.
Well, Mr. Chairman, if I might explain the proposal that I have here, and I think everybody has a copy. If you don't, let me know, and we'll make sure you do get a copy. This sheet, it's called the timeline for calendar year, plan year, and revised 80-20 rules. There are actually 4 different proposals in this one-page sheet. The first is it's changing from a fiscal year basis to a calendar year basis. And I make that recommendation basically for 3 reasons. One, allow us, the PEI and Finance Board, to make their decision based on the actual appropriations approved by the legislature and not the proposed, the governor's proposal for funding of PEIA. 2, the staff is really, PEIA is really hard pressed, particularly in the years following the gubernatorial election, when the legislature doesn't get out until mid-April at best, and they have to begin the plan year in July 1st, trying to get the shoppers' guides out, hold hearings, educational forums for people, and do all that in a timely manner. It really puts them through a lot, and so it would ease the burden on a very, very small staff here at PEIA. I personally think it's too small of a staff, given the task that's in front of them. I know people don't like to talk about increasing administrative costs, but I think it would save us money in the end, but that's kind of a separate issue. The third is it would allow PEIA to do an even better job of educating the beneficiaries. It gives them a lot more time to do that. So basically, and I haven't had a chance to talk with Mr. Cheatham about his time frames, and so if he or others want to modify it, it's fine. I thought that, starting September 15th, have the actuary report to the governor what the cost increases are going to be for it beginning the plan year about 15 months later. So if it were in place, had been in place this year, had it been in place this year, January 15th, we'd be talking about the plan year that begins in January 1st, 2020. And for those that I circulated the meeting, I added a little something today on that, making sure that the actuary updates the governor on what's happening in the existing year, so the governor is aware of what's going on with that. The governor in January makes the state of state, makes his or her budget proposal. The legislature considers that in mid-March. In most years, in mid-April, following the gubernatorial election, they complete and appropriate pass a budget with the PEIA appropriation. Shortly thereafter, the PEIA Finance Board would begin a draft plan and would go to public hearings in May of the year and complete the plan later in May. And then in September, you begin the educational programs around the state that PEIA staff does regularly, and you send out the shopper's guide. And then the open enrollment occurs. It coincides with Medicare's open enrollment, October 15th through December 7th, with coverage beginning January 1st. So that's of the four proposals that I'm making. That's the first one. We change the fiscal year to a calendar year that allows a lot more time and meaningful input. I think it would enhance the product that we. The other three portions of this deal with the 80-20 rule. The first would be to say that the legislature would appropriate at least 80%, and the employees would pay no more than 20%. Now that would allow the legislature the flexibility in a year, for example, when they're not going to give salary increases, and I hope that doesn't happen anytime soon. But we've had it in the past where the legislature said we can't provide a salary increase. But we don't want the employees to absorb the increased costs of PEIA, and therefore we're going to pay 100% of the increase. Well, they can't currently do that under the statute. When they put in additional monies into PEIA, it automatically triggers an increase in employees' premiums. Now, at least and no more language would allow the legislature to some flexibility in those years that they want to pay more than 80%. It doesn't require them to pay more than 80%, but it allows them their flexibility. The third part of what I'm proposing allows the PEIA Finance Board flexibility in deciding how to distribute that 20% or 15% or whatever it is that the legislature doesn't appropriate. And that they could consider not only increases in premiums, but increases in cost sharing, whether it's increases in deductibles or co-pays or co-insurances to make up that 20%. And I frankly think that, that, as I said earlier, there's this tension between increases in premiums and increases in cost sharing. Increase in premiums are spread out all the way across the board, but that impacts people who don't use the system. Cost sharing, whether it's increases in deductibles or co-insurance or co-pays, it's primarily targeted those who utilize the system more. I think a good combination of those increases in cost sharing and increasing in premiums would generally be the appropriate place to go. So you have not spreading out all over or concentrated all on employees who use the program. Giving the flexibility to the PEIA Finance Board makes a lot of sense to me. The third proposal, or the fourth proposal in this series in this one page, is to recalculate on what the 80-20 rule applies to. Currently, the 80-20 rule applies to whatever the legislature appropriates. If they increase, then it imposes that. I think we should base the 80-20 on future growth in PEIA expenditures. And so as growths go up, it is split by at least the legislature appropriating either through general revenue or through special revenue accounts, appropriating 80%, up to 80%, at least 80% of that growth, and the employee is absorbing no more than 20% of that growth. That doesn't get Dale where he'd like to be, which is no increase, no cost shifting onto employees, but it does get to a stable, secure program for the beneficiaries. And that's when I heard the most when I went out to the public hearings and when I visited schools. More than anything, what I heard people wanting was they wanted a stable, secure health insurance program. They didn't want like in 2018, where $43 million were shifted on to the employees, and the state contributed nothing. That's the kind of things that they were most disturbed about. And this proposal, and say that I've thought a lot about this, and it's the only proposal I can come up with that actually fixes PEIA and gives the beneficiaries a stable, secure health insurance program. And I mentioned earlier with meeting with Bill, the other thing it does is it elevates PEIA funding to be equal with retirement funding. Right now, our retirement system is if the investment management board doesn't make 7.5%, the legislature makes that up and raises that to make sure that that 7.5% is made. So it gives a stable retirement system. This would elevate PEIA to the same status as a retirement system in terms of funding, and make sure that the state meets its obligation and the employees meet their obligations too. So I think all four of those proposals have merits. They are roughly sketched out in a one-page summary, but that's the kind of thoughts that I have about how we can fix PEIA, Mr. Chairman.
There are a couple ways that we can do this. We can formally make the motion and second and have discussion then, or we can have discussion on the proposal and then
discussion first, and then we can figure out where we want to be on a motion.
All right. Agree. All right. I just wanted to make sure that we're following proper procedure here. So, is there discussion on the proposal? And by discussion, I'm also opening up to the PEI Finance Board. You may have questions about this, or Ted have questions and things. So, Ted.
So listen, we can easily support the Perry's proposal to go to an annual. All I'm asking is, I appreciate the attempted date. It's close. You really need to let us, you just need to say, make it a calendar year and let us drive if you don't mind, drive the dates and times. We've got Section 125 IRS requirements to meet, and we truly can't run that for all that ACA testing. We can't run it to December 7th, for example. So, okay. No, we support you. I'm not trying to poo-poo.
No.
I'm just saying, if you're going to do something, just say, go to calendar year and
let you work
figure
out.
Figure it out. Yeah. That was all my only comment.
That's fine.
Joe?
Perry, I'm trying to, again, just grab my arms around this, and when you refer to the piece of we want the participants to know what their costs are, is your, and I'm just going to throw this to you because it's your proposal, but is your goal to limit the increases to the participants every year, or just limit how those increases are calculated? Because I'm trying to get my arms around whether you're saying we want to have a stable program, and we don't want to see ups and downs in the participant costs.
Right.
But I'm trying to see how far you want to go with that when you say control costs. Do you want to control it so that the costs are really, really controlled and they don't go up, or that we can just get our better arms around the 20%? Because on the first part, with healthcare costs the way they are, I don't know how we can develop a system that says the participants never have a cost increase, or that we limit. And I don't think you're saying that, but I'm trying to clarify.
And I am saying to limit that, but
I don't know how you can limit it unless you can limit a 5% control in a 5% inflation in medical costs every year, or 4%. How you control costs for the state and the participants?
Well, the cost, cost containment is the heavy lift.
Well, I agree with that. That's a two-way street.
When I served on the PEI Finance Board, I voted to implement over the strong objections to a lot of people, implement the MAPD. And Dave, you might remember the figures, but I think we saved the state $500 million over a 20-year period. There's something in that neighborhood. It was a ton of money that we saved, and I think. And that was a very difficult decision we made, but I think it was the right one. In hindsight, we look back at it, and I'm very proud of the amount of money we saved the state and the program that we implemented. I think we need to continue to do that. Mr. Cheatham has been very clear in one of our other previous meetings is that he's done, the staff at PEIA has done everything they can around prescription drugs. If we want additional cost containment measures, they're going to have to be statutory. I've circulated a 20-page report on what other states are doing to control prescription drug costs. I think that somebody, the cost containment, your subcommittee ought to bring in the National Academy of Healthcare Policy.
I get it.
You know, but we need to do all of those things. We need to keep down the cost of PEIA, in my opinion. And at the same time, my proposal is to limit the exposure of employees.
Well, okay, I guess all I'm trying to say is when the Cost and Revenue Committee gets together and we come up with cost savings, which would mean program refinements,
Right.
and the other side is revenue enhancements. There may be limited revenue place sources to go that are dedicated to whatever. That's a different discussion. But I just don't want to be in a situation where we look at numerous ways to, I don't want to use the word cut benefits, but make changes to the program, and we get pushback because the participants don't want any changes in benefits. They don't want any tell us how we, like the 90-day drugs, for example, the maintenance drugs. We know there's savings with that, but there were people unhappy about that.
That's right.
And so
That's
I'm
right.
just saying, where do we draw the line between, I know you want to control costs for the participants, I'm all in on that, but when you have cost increases each year, there's only a few ways to do it. It's to come up with more revenue, which there isn't always going to be more revenue, or we have to cut the cost of the program, or do something in between. And maybe I'm not explaining it correctly, but maybe Senator Blair is
Well,
with me, because I see this.
I'm distracted, and the reason for it is that, if I may, Mr. Chairman, I think that we ought to be managing this subcommittee a little bit different. We ought to be taking each one of the items that we talked about, instead of us talking to each other and having them as spectators. No, I want the board.
That's fine.
Board's opinion on the calendar, the pros and cons, so that they educate us. The 80-20, the pros and cons. So we don't have to make a motion here at all, because the next time that we have a PEIA task force meeting, we can meet before that and then come in with even more knowledge than what we gather here. Gives us time enough to reflect on all these proposals and do the right thing.
That works.
And then walk in and do it. You see what I'm saying? But we break out each one of these so that I can get to, maybe I'm not as bright as you guys, but I want to be able to pick up from these folks in here on what we're trying to do here, the calendar. I know Ted said he could do it. I want to know the pros and cons of that, so that if it's a good idea, then I'm going to be the #1 advocate to go back to the legislature and sell this idea. So if we broke it, you see what I'm saying?
And Senator, just so you know, my plan is to have us meet again before the full task force meets, I think in January, the 8th. So it's not that we have to come up with things today. This gives us the opportunity to have the discussion, but we will meet again before the full task force meets, because we're going to make recommendations.
Well, if we may, for my help here, let's break out what he's done here
So the
and
calendar.
get at it.
Questions?
Mr. Chairman.
Yeah.
Ted, what's the advantages of doing the calendar versus the fiscal year? Because our financials are based on fiscal year. So what is this gonna do? I mean, what's
Yeah, so,
advantages, disadvantages?
so, boy, that's a bigger question than you give out. In the big picture, I really don't think it matters. I mean, that's seriously, it doesn't matter. We moved Medicare to save $10 million in reinsurance to 1/1 because we were losing money. That's why we did it. Otherwise, we wouldn't have. And by moving Medicare to 1/1, we saved all that money. But now we've got split years, and we got all kinds of problems with split years, right? Now we have split families on Medicare and PEIA. We have split years. So retirees have a whole new open enrollment and a whole new shopper's guide, and we've got the other for the actives. And when you got split families, it's a mess. So there's a lot of advantages to putting everybody back to 7-1 now because we moved Medicare. The other problem is the accounting for the split year. Can the legislature really allocate money for the second half of the year that falls in a different budget year? The answer is I doubt that you'll cut our funding when you give it to us the next year. It's typically growing. I don't know that's an overcoming problem, right? Dave and Chris and Jason and all his staff, we're already accounting split year on the Medicare side. It gets complicated as heck to look at the numbers between 2 fiscal years, but we can do it. We can do it. I don't know what else you want me to tell you. Jason, you actuaries, anybody want to say some other issues?
Just a quick comment. Perry, first off, thank you for this. Sorry, sir. Jason Hott, Chief Financial Officer at PEIA. Perry, thank you for this. This has got some nice information in it, and I appreciate the proposal. I agree with what Ted stated. I do want to mention just one thing that I've noticed in my tenure at PEIA is that I think having the budget process at the end of it, and this is the analogy of the kid goes and asks his dad for something, he says, I don't know, go ask your mom, okay? And if he doesn't get the answer he wants, he goes back and asks the other parent the same question until he gets the right answer. I think having the budget process at the end of this, at the legislature at the end of the process, so that you don't have, for example, when the board did decide to how they want to distribute the 20% increase, whether it be in benefit adjustments, deductible increases, or co-insurance, or pharmacy changes, if it doesn't, set well with everyone, then, it's nice to have the final say at the end by the legislature to assure everyone's on the same page, and then we can go right into the plan year. I think some of these ideas are good. I think they could be implemented, though, in a fiscal year schedule. We could possibly shift this so that it stays on a fiscal year basis with the legislature at the end of the process. Thank you.
So the other thing I point out to you, one of the things you want to solve, and I just want you to think about this, is what Perry's saying is that we do a plan in an election year. If you don't like, as a legislature, what we've done, it goes to the legislature and you argue about it, you talk about it, you change fund, you give us more money, you take away money. We put a shopper's guide together that goes to the printer in the middle of March. We open enrollment in April and May. In an election year, you're still in session, and our open enrollment's potentially over. And we can't make a change at that point because, again, we've got IRS requirements to be live on 7/1. This solves that issue and lets the legislature get over and give us a budget. Just want to caution you, though, just because the legislature says, PEI, here's your budget, well, the board then takes the budget, builds a plan to take out, that we'll take out whenever that is, July, August, September, to tell people what we want to do. And the board at that point says, well, hell, let's do total family income. Now what happens? There's no legislature now to come after us. You're out of session unless you call a special session. So the board does something that you don't like, there's going to be an issue. I'm not saying we're going to do that. It's just, do we have to scope the plan more focused to the budget with the legislature? That's probably where Perry's heading. So we'll know ahead of time. Legislature puts their stamp on it. The board comes up with the plan at the same time, and it gets blessed coming out of the legislature, and then it's kind of done. I think that's where Perry wants to go, is getting the legislature a little more involved in the budgeting, and the budget is so tied to benefits that there won't be any of these fights anymore at the finance board, the governor's office, and the legislature. So there's another plus, I think. Did I say that right, Perry?
Yep, no, you did. I think it is important for the legislature to be more involved in PEIA. There was a senator last year during the strike that said, we don't have anything to do with PEIA. Well, we need to look at health insurance and retirement and salaries and vacation days and all as a package. And the legislature needs to be involved in that discussion.
Other discussion, other questions?
Perry, you heard Ted talk about the actuarial valuation of 80/20. It seems to me that's where your version of 80/20, rather than just a premium 80/20. The whole plan's 80/20, even though the premiums might be 84, or the benefit might be 84 Thank you.
It really doesn't address the actuarial value. What I'm trying to do is place the 80-20 on future growth and
That's what,
and expenditures.
That's what we'd have, is we'd use our actuaries to say, okay, this is the plan, what's that gonna do a year out, 2 years out? How much money are we gonna need for that?
Right.
Okay, we agree on that.
Yes.
Here's the big question, okay. That says we need 80% from the government, legislature, we need 80%. Or at that moment, are we guaranteed we're gonna get the 80%?
Well, if you change to a calendar year basis, you can do that, yeah. You would develop a plan after the legislature has met and made their appropriations, and so you'll know exactly how much money you would have. You know?
Okay, let's say we need 80% and just to use my fuzzy math, we only get 60%.
Right.
So we now have to do both premium increases and plan changes.
And actually, my proposal would say that the PEIA Finance Board, if they didn't get the 80% from the legislature, they could use reserve funds to make up that difference.
Okay. I understand that, and we did that for 3 years, and we got the reserve down to zero.
And I put that proposal in there, not because I want the Finance Board to do that. I put it in there as an encouragement to the legislature to make their 80%, so you don't take one-time monies to pay ongoing expenses. It's really, the current legislature cannot force future legislators to take a certain action. So you want to build in an incentive for future legislators to make sure that they meet their 80%. And that was the Hammer proposal, and there may be other proposals out there that really encourage the legislature to meet their 80% requirement. But my proposal would be you could take one-time monies to make up. And again, I hope that never happens. I just want to incentivize the legislature.
But my problem is that in the past, when we've tried to do that, we've come up with the situation that you were describing. Healthcare costs, prescription costs just skyrocketed, and we knew we weren't going to get 80%. I mean, it was just the money. It was just an astonishingly high amount of money we knew we weren't going to get. So, I mean, I don't see how that's going to translate into a stable PEIA platform of benefits and costs. I just don't understand that. When we have the escalating healthcare costs coming at us, and as Senator Blair mentioned, the West Virginia pie, we're hoping is growing, but right now it's not. So, you know, we have limited fiscal resources. It's got to be distributed not just to PEIA, but to other state agencies as well.
For the record, our pie's grown a little bit.
A little bit, yeah.
Yeah, and I'll take a little bit versus the other direction.
Okay.
Absolutely.
Yeah, the
Okay,
question.
well, anyway.
Okay.
In terms of the actuarial reserves that we've established, and I apologize, I'm going through a cold here. There isn't a lot of room as far as using the actuarial reserves to meet a deficit. Right now, I think we're showing next year we have like maybe 7 or 8 million that wouldn't really solve too many problems. But the reserves we hold are pretty much the minimal. I mean, I feel comfortable with the reserves I sign off on, but I don't think you'll find another actuary that's, you know, making a lower number or anything. But so there are some restrictions there.
So, Perry, so what you're saying is the 80-20, 80% employer, 20% employee for the growth. You're saying if it's a projected deficit of 100 million, you're saying that the state come up with 80%, and then instead of the employees fronting 100%, you're saying 80% state and 20% on the back of the employees.
That's correct.
Is that what you're saying?
That's correct.
I think what he's saying is no less than 80% and no more than 20%. So it doesn't it doesn't lock you in. If the state wants to put additional money in, it doesn't lock us in like the 80-20 restriction is right now. Right now, it's, you put 80 million in, we put 20 million.
It's a flexibility issue.
The other part
that's based on
that's really,
premiums today. That's
the other
based
part
on-
of it's really important is, to me, is that the finance board can make that 20% up in either premium increases or cost sharing increases.
So the
Do you have
20%,
that flexibility?
20% comes back to us to work with.
Yes,
That 20%.
yes, that's exactly right. I'm Jeff.
No, that's, I was just saying, it's just, you know, right now, we're just so limited on what we can do. I'm just making a general comment about it. And that dictates a lot of the things we can do.
And I want to give you a lot more flexibility than you
Right,
currently have.
right.
Can I ask a question? Ted, one year, we got some money from the governor or somewhere, and we got legislative approval to apply it to our plan without incurring the 20%.
Yeah, so I did mention there is a loophole.
Okay.
There is a provision in the code that under certain circumstances, the intent of the code is to do 80-20. That is the intent, move money over and keep that split. There's been some odd circumstances on a couple of occasions where the money has come to us as not to go towards premium. I think the first time that occurred is we were doing a 2-time max out of family, and we decided to go to 1.5, so we needed the extra money, and the governor put in like $6 million, so we wouldn't have to make the benefit change. And it went strictly to us without going to premium because it was to cover a benefit line item. That's what it's designed to be used for. It was taken away the next year, by the way, but that's what it's used for. This last time, the 29 million, 8 of that 29 million went into premium because we weren't quite at 80-20, and 21 million came over as not to go to premium in the last plan year when we got $29 million. So it has been done. I don't think that's the intent of the legislation. Is that your point?
Yes.
Yeah.
Would that stay in the new proposal, that exemption or loophole?
You wouldn't need it. You would have the flexibility, you know, under this proposal, you'd have the flexibility to say this is premium increase or this is, you know, yeah.
So the 80% is unrestricted.
Yes, that's correct.
I just want to follow up on Senator Blair's question to the board. I guess I'll say it differently. If you were king for the day, you could redo or take some of the handcuffs off that you have. Do you have any guidance for us as a committee? I think that's where you were starting to go originally.
Absolutely.
I think this is an excellent start right here. I mean, this at least gets us a line item in the budget. It gets us in there and gets money for the employees to try to stabilize healthcare, rising healthcare costs. I think this is a good start.
Definitely makes it more flexible, right?
That's the intent.
Yeah, I mean, I just keep saying that over and over, I know, but it's really.
I know when I was on your side of the table,
Yeah.
there was very little wiggle room. And
Right.
And you need flexibility to address different circumstances.
Well, you gotta have the flexibility to be able to address some of the things that need to be done to update, that will have to be done to update the plan, right, to modernize it, right?
How about outside of the 80-20 piece as far as things that you maybe tried to do but you couldn't because you said, no, statute says we can't do that? Is there anything that jumps out at you outside of the 80-20? Like around benefits, or if you wanted to implement something and you can't?
So, yeah, sending people to Thailand for services or buying drugs in Canada? No, I mean, no, I'm joking. Yeah, I mean, it's funny that we joke, but Utah does it. I know, but right now you gotta. I mean, those are real conversations.
Yeah, I agree.
Utah gives an insured $500 to go to Tijuana and buy medication. Every time they go, $500. And what they say in the Wall Street Journal is they're saving 40 to 60% still by doing that. So, yeah, I mean, you're saying that with the way that this is moving so fast, you almost can't move fast enough to keep up with it. But it's not going to slow down anytime. So yeah, there's a lot of other things that could be on the table. I don't know about that, Ted, or anything other that we've kind of run against, at least as long as I've been on this side, that we haven't, been able to craft something up to address.
We had a comment in the back.
Just had a question for the task force proposal. Perry, would you envision the 80-20 premium ratio staying in place in addition to this growth 80-20?
Yeah, well, Jason, I'd have to think about that, but it really, my vision is to change the 80-20 calculation so that it's based on future growth as opposed to exist. I mean, everything would stay in place currently, and then all future growth would be split 80-20.
Right. So we would basically, the year that we start this, the baseline would be set and ready to go, and anything above it would be 80-20. So
that's exactly right.
I guess just to be sure that, I was just thinking through the scenarios in my head while we're discussing this is, you know, we get out of whack, just like Ted just mentioned. We used $8 million here this current year to increase the employer to keep that 80-20 premium. You know, I guess we could keep that in the background and leave that in place so that that doesn't get, you know, askew and as the tiers change, salaries change, the proportion of the employer employee. So just was curious, trying to get clarification on how we handle that aspect of it.
Can I ask Jason a question?
Just a second, I want to make it clear again that this is not a definite 80-20, this is at least 80% and no more than 20%, because this is going to be viewed over and over by the educators and state employees out there, and I don't want them to think that this is an automatic, the state's only putting in 80% and we're putting in 20%. That's not what we're looking at. So, Mike.
Jason, do we need some flexibility on calculating the 80-20 as defined by Dale throughout the year? Because we do get money during the year, in this case during the calendar year, like that $8 million.
I think annually is, the way we do it now, annually is sufficient.
The other thing I want to point out is that this proposal that you're making recognizes that there are continued increases in health insurance costs. And this puts a line item in that it's going into the general budget, that we are addressing that the increasing cost. It doesn't say how we're getting the revenues to do that. That's for a separate discussion, but it does address the ongoing increase in healthcare costs.
Yeah, and let me make a comment to that. And that is that being in the general revenue for this is far superior than to have any line item to revenue dedicated to it, is what I'm getting at. We've heard that.
Dale and I agree with you.
Yeah, I know, but
we both agree with
when you're on camera, it's well worth mentioning this. If we're looking out for the best interest of our state employees and everything, then you don't, as the finance chairman, I don't think I've ever had anybody come in and say, I want tied to this or that. Do you want to be in the budget itself? That way, if one thing's up and one thing's down, you got a much better chance of being able to have that the funding.
And while I agree that it's important to have it in the general revenue as a line item in the general revenue, because the pie is only growing at a small rate, we need to grow the pie a little quicker or bigger to do that. But I agree with the concept that it has to be a line item.
And it's more manageable.
Yeah.
For that matter. I've got a question here, and I was going to hold it off. But you know, I've heard that I like the idea of no more than 80% and no less than 20%. But if we run into a problem, and I'm looking at it as a banking mechanism. I've heard out there that you know there's a potential that maybe some year it would be to the benefit of everyone that it goes down to 77% or something like that. But what if the state, you had to, say the first year it's 80-20, the next year it's 85-15, the next year it's 85-15 or 90-10, doesn't make any difference. Then you hit a hot spot, a bad spot, and the state needs a little relief. Is there any way that we can think about banking that number so that you can fall in below that?
Smoothing it like we do the retirement system.
Right.
You know, I'd be willing to take a look at that.
Yeah, that's worth a little bit of a consideration for that, because then the state has actually demonstrated their commitment on that, and if the state gets into a little bit of a tough spot or whatever, then they could draw on those reserves, a small amount, for that to smooth it out to go forward, so.
I think that has merit.
I was hesitant to talk about it because I don't want things to get out there that undermine what we're trying to do.
And I agree, we don't want that, but it is something that we will look at, and the smoothing process seems to make a lot of sense.
That makes a lot of
Because that's what
sense.
you do.
That makes a lot of
That's
sense
what
to
you
me.
do in the.
So if you're having a good
analysis.
year, the state's having a good year, you can fund 100%. But if it's not so good year, it may be 90-10, but it can't go any lower than 80, correct?
It could, if the legislature were more generous than the 80-20, then it could go below 80 at some point.
Under the smoothing.
Under the smoothing.
Has the potential to do that.
Right.
But it's sort of like the retirement plan. We're not tapping in. We could have redone things on that, but we chose not to. We want to stay the course on getting it straightened out.
There's been proposals, you're right.
You're right.
And we have stayed the course, and I commend everyone for staying the course on that.
Past legislatures and hopefully future as well.
I hope so.
Would that keep the board from using the PEIA reserve fund, or how would that work with this smoothing necessarily? You know, because we said if they did it.
You would have to increase cost sharing to employees to make up that difference. So if it went to 75%, you know, because the legislature made it 90-10 for a couple of years, and that now they only put in 75%, then you'd have to make up the 25% in cost sharing to the employees, cost shifting to employees.
And my thoughts on what I was saying that is it'd be a short term. That where you're in a budgetary issue, but you've already banked. It could be 100% or whatever, and I'd be willing to say that, you know, when I was barking those numbers out there a while ago, let's say you got 10% in, the legislature can only take advantage of 5% of down underneath. That's some form of that.
And that's something that, in addition to what's on the table here.
Yes.
That this subcommittee will look at. That's a perspective.
I was hesitant to even bring it up. I should, but it's a smoothing mechanism to get flexibility.
But I think there'd have to be some safeguards in that.
Agreed.
There'd definitely have to be safeguards.
So Ted, would our reserve, if we have a reserve, would that go toward the employee's part or the state's part? If, like this, we got this 50,000 laying in reserve that we're gonna shift.
It actually, the reserve that we use, the excess surplus that we gained from prior years that we still use over and above the required minimum reserve is net across everything. It doesn't apply to, it just applies to benefits. It keeps the benefit from us having to cut benefits is all it does. It's not looked at as employer-employee, it's just.
So using that 53 billion, shifting it over with this example, who's it gonna benefit?
It's gonna benefit all the members.
And the employees.
It's not gonna,
Okay.
And it benefits the state, because the state does not have to put in another 80% of that 50 million, because we're spending it out of our pocket.
Yes, sir.
Ted, while you're up, Ted, the reserve, what's the minimum and where are we at right now?
So the minimum is,
Recommended minimum.
is 14% of cost. At the end of FY20, under this proposed plan, we're gonna be just above, we're gonna be right around 14%, just a little above 14% at the end of 2020 under the proposed plan that was adopted today.
Where are we at today?
I will tell you, I can look, I think we're just under 200 today. We'll be at the 14% is around 119 million. That's where we'll be at the end of 2020 on the proposed plan. That's a better number to talk about.
I know that's a better
He
number
wants
to
a
talk
percentage
about.
now.
Where are we at today?
I will get that for you in just a second. Chris is looking it up right now. Yeah, I have it.
At 20?
Around
20, you said 20%, what's the dollar amount?
Our projected ending reserve for 2019 for the state is 161 million.
161 million?
Thank you.
Other questions?
So, calendar. Were we in agreement that this is a good idea? I've heard that you were a lot all over the place. Yeah, we can do it and everything, but I'd like to get a little bit of a firm understanding so that I can, I've heard a lot of discussion, but I still, maybe I'll ask the press where it's at.
We will be happy to develop a pros and cons list to provide to this committee.
And I think what I heard you say was, with the change for the Medicaid retirees, it does make sense to have everybody on the same level, and that may be moving them back to July 1st or something, so.
It makes no sense to move them back July 1st, we'd lose money.
Okay, but the pro is, it makes sense to have everybody on the same, but you'll come up with a list of pros and cons.
We'll give you a list of pros and cons.
Okay,
That's the
great.
best way to go instead of trying to speculate here.
Yeah, I think that's the best way.
I'm looking at the calendar, Mr. Chairman. I think we meet as a committee on the 8th. I think that's.
January.
The task force is
The
meeting on
task
the 8th.
force
Excuse
meets
me, the
January.
8th. Yeah, so if you wanted to have a meeting before that, I'm just saying you need to look at the calendar.
Yeah, do you all want to do it that morning before that, or do you want to do it the 7th?
Well, there's interims going on, so I
Right.
would defer to Senator Blair, who maybe the 8th might be better in the morning.
I'm gonna be here regardless, we'll be here, and this is a priority for us.
Yeah.
And so just set it for whatever you need, and we'll manipulate accordingly.
Well, I was just thinking the 8th is kind of the 3rd day of interim, so you may be winding down, so.
Yeah.
if we
Is that
did it on-
Tuesday?
Yes. So
What
I thought-
times?
I mean,
Tuesday
say-
would probably be better.
That's what I'm thinking,
Yeah.
because Sunday and Monday, you
That's what
can find out.
I'm not sure that we set a time.
I thought it was
All right.
around
For the
1.
So if
Was
we
it 1
could
o'clock?
meet
I
at.
thought it was 10 o'clock, so.
Okay.
But it could, it's a moving part, whatever you want it to be.
Well, I had 1. Somebody mentioned 1
I
o'clock
had
at the
one- I had
last
one
meeting.
too.
Yeah, I thought 1
Yeah.
too, so.
I think we went 2 o'clock. Okay, 1
So
o'clock.
if our subcommittee
1 o'clock.
meets at 9 o'clock on the 8th, is that good for everybody?
A little early for retirees.
All right.
You're gonna have a big.
That means you'll be there?
I'll be there. We'll meet at 9:17, does that help you?
Not's fine.
All right, so they'll send us a note.
So we need to post that in the Secretary of State's. And that will give us the pros and cons of the calendar year, will give us the look at, opportunity to look at 80-20 and the possibilities of smoothing with some safeguards, and that gives us direction that where we're gonna go. Everybody good with that?
May I say something?
Yes, sir.
Board? Look, you guys to know things that are going on that can actually make it better. Ultimately, and I don't like speaking for the entire legislature, but we want to do better. And it's a balance of some of how we're managing. There's been times where things are so confusing to the consumer, our employees, that it becomes very, very frustrating. And, you know, we believe that in the legislature that we're spending good money and we want good results for what's going on for this. This is the tax, and we're representing the taxpayer, each and every one of us. I'm not saying anything, I'm not being negative. What I'm actually saying is that if you see something that there's a legislative problem, a roadblock from being able to do your job better, and this is the same message I give to agency after agency after agency when they come in. We want to know. Don't hesitate to reach out to me or any other legislature. I welcome it. If you got an idea that you see that something's going on, and this applies to everybody else in the room. I made the same floor speech to the teachers when we gave the pay raise. They know where the problems are. We need to know about those so that we can actually look for viable ways to shove the pieces of the puzzle together to be able to make it work so we paint a beautiful picture for the state of West Virginia and we all prosper from that. But lots of times the lack of communication before us undermines, and we end up with bad results because we didn't know that what one hand was doing versus the other. And I understand that we're autonomous, but there's times that we can help you so much, and then there's many times that you can help us so much understand things.
And Senator, you did make the same speech when you passed the pay raise instead of getting the pay raise.
Hey, well, don't judge me on
I'm not.
on a simple word.
I just had to have a little dig. I'm sorry.
We want. I'm still just trying. I'm not a great communicator, but everybody knows what I'm saying.
I was kidding. The other thing, Ted, I would like for us, our subcommittee, to look at is have the attorneys tell us any other things in the statute that we may need to look at to help, quote, fix this plan somewhere along the line. I'm sure there are other statutory requirements that need to be looked
Senator
at.
Blair, if you want to do something with spouses,
Stand up, can't hear.
if you want to do something with spouses, there's clearly going to need some statutory language there for this change. Yeah.
That's usually we talked about at the last committee meeting.
Yeah, we talked about that last committee meeting. I'm not done with that because I believe that that's a fairness issue.
We'll get to that, but I meant if there's anything else statutorily.
Well, I didn't bring it up. He did.
Well, that's been mentioned. There's
That's an example of other statutory things that would need to be looked at, and that's the purpose of this subcommittee, is to look at the statutory requirements.
Well, Hal, I'll tell you, if it doesn't get dealt with this committee, I'll deal with it at the Cost and Revenue Committee. So, as a recommendation to the task force.
I didn't say we wouldn't discuss it.
Either way, we have two shots to address it.
Well, we have 3 shots. It doesn't prohibit any task force member from bringing something up at the full task force meeting. So we have, this is just the things that we can do.
Well, Senator Blair, we hear it in all of our public hearings and stuff, and I've talked to Ted about this. They want us to be advocates and stuff, but the law prohibits us anti-lobbying. I mean, we can't, I just can't come, we just can't come to your office and start, we signed an agreement that we can't lobby.
But we can do it this way, can't we, sir?
This way's perfect, absolutely, having meetings like this, but am I right, Ted?
That's right.
And
We want to be advocates, but the law prohibits us from lobbying.
Well, I'm missing something. You have to be a registered lobbyist to lobby. Is that correct? But you can actually come to me as a board member, get the lawyer out here and to find out, because I'm not a lawyer. But if you come to me and say, hey, on an individual basis that this or that's going on, you're not speaking on behalf of the board and everything. You're really not lobbying. You're making the legislature aware, or me aware, of something that could take place. Now, whoever the expert is in here, tell me otherwise.
I'm happy to take a look at it and give you a firm answer, but I think the way you described it actually is true. That being said, I'm not giving you a legal opinion on it at this time.
But I will go back and say one other thing. I am not adverse in any way from us coming over every 2 months, every 3 months, whatever it may be, and having a relationship so that one hand knows what the other hand's doing, and we try to work together for the good of our employees.
That's why we're here.
We're all in this, playing the same role here on this, but sometimes we just don't know what's going on.
I'm also going to invite the Finance Board to join us on the 8th at 9 o'clock if you'd like. And if you need to do it by phone or something like that, then we'll make those arrangements to be able to do that. But it is important to have the continued dialogue.
I think it's a very productive meeting, and I think you're on the right track.
Thank you for having us today.
Thank you. Anything else to come before the subcommittee?
Move to adjourn.
Motion to adjourn, is there a second?
Second.
All in favor, say aye.
Aye.
Thank you all for coming.
Thank you for coming here.